Hi, I'm Dr. Sherman Silber from the Infertility Center of St. Louis, St. Luke's Hospital, and I'm going to answer any questions that come up that you guys might have out there, or you women might have out there about infertility and reproduction. This is just a free-for-all Facebook Live, and if we don't get to all your questions now, we'll just send in the questions anyway, and we'll get to them in another Facebook Live. So we're here at St. Louis, and it's Dr. Silber, ready to answer questions.
All right, thank you, Dr. Silber. First question is that how widespread is infertility?
Okay, so widespread infertility is absolutely a worldwide epidemic now. One used to think of it as only affecting 2% of the population, but that was when couples were getting married at age 20 and they'd have all their babies by the time they're 25 or 26 and then worry about birth control. It was a different era, maybe 3 generations ago. But it's a different whirlwind, and couples are putting off childbearing until, well, they're either their late 20s or their late 30s or even their 40s. And it's on the female side that the egg is deteriorating and they have a lower fertility rate. Now, the male side is a different story, and I can get to that later. But there is a huge, widespread epidemic around the world, in all the developing world, where couples are putting off childbearing. The incidence of infertility in a teenager is about 0.2%. By the time you're 30 years old, it's about 20%. So there's just an enormous decrease in fertility from your teen years, when you really don't want to get pregnant, to when you're in your early 30s and are thinking about finally getting pregnant and thinking you're still young, but your eggs don't really think you're that young. So it's a huge problem everywhere in the world. The most common reason for seeing a doctor is for infertility. Even in overpopulated countries like India and China, it's been the major reason for actually seeing a physician, is the inability to get pregnant and have a baby.
Thank you. So are there some specific reasons for this epidemic?
Yeah, so what are the reasons for all this infertility? Well, you will hear a lot of different diagnoses, but if we just really cut to the essential issue, for women, the commonest problem is that they're not trying to get pregnant until their eggs are older. But also, even when they're younger, a lot of women have a condition called PCOS, and it just means that they're not ovulating. And they're confused about it. The reason they're not ovulating is not some mysterious metabolic disorder that doctors often speculate about. These are women that just were born with too many eggs, which sounds really strange. It's great to have too many eggs because you're going to have a very late menopause. Maybe instead of age 51, menopause might be at age 65. But you're not going to ovulate when you're young, because all those eggs will inhibit your pituitary gland secretion of FSH, and so you really won't ever select or recruit a dominant follicle. So you have irregular cycles, and you don't ovulate, and that's a common problem, and it's always been a common problem, but it's getting worse and worse, and hard to know exactly why. For the male side, the same old problem that many men have very low sperm counts, and it used to be that this would get in the way of having children. But of course, now we can do IVF procedures where if they have any sperm at all, then we can have normal pregnancy rates. So those are the commonest issues. I could go into a lot of specific differential diagnoses, but that's the big picture.
So you mentioned low sperm count. Does having a low or even maybe diagnosed as 0 sperm count make pregnancy impossible?
Well, we used to think it made it impossible. Even with IVF, the biggest problem before what we call IFC was male factor infertility. If the count was too low or the sperm weren't good quality, they couldn't fertilize the egg even in a petri dish. So IVF really wasn't very successful until we figured out how to directly inject the sperm into the egg. And we were amongst the groups that invented that procedure back in 1993. And so even if there's a few sperm, a few poorly mottled sperm. We can pick those sperm up with high magnification, 400x, and a little tiny pipette invisible to the naked eye, and actually inject it into the wife's egg. And we used to jokingly call it fertilization by brute force, but we'll literally inject that sperm. The sperm does not have to penetrate the egg. We'll actually do the injection. We call it IFC, which is short for intracytoplasmic sperm injection, but IFC is just the common word, ICSI, and we were among the early inventors of that. But it gets even more interesting. What if they have no sperm at all in the ejaculate? Well, most of the time, not all the time, but most of the time, if we do microsurgery on the testes, and we do it under local anesthesia, and it's painless, we can find a few occasional sperm in the testes that aren't getting out into the ejaculate. We can pick those sperm up, and again, no matter how few, we can inject them into the wife's eggs, and we have a normal pregnancy rate. I remember an anecdote of a couple that came to me in the 1980s, and he had no sperm in the ejaculate. We had done a testicle biopsy, and well, we really didn't. We saw that it was maturation arrest, and he wasn't going to be able. We told him we would never be able to have children naturally, and they didn't want to use donor sperm, so they were childless. 10 years later, I had to send them and hundreds of other letters saying, guess what? I think we can find sperm in your testicle. So we did, and I remember this couple. It was a really phenomenal case, and they were the first couple that came back after I said, forget it, you can't have kids. And we went to the testes, we found just a few sperm, and he has two normal babies now from that. In fact, those babies are grown up now, and they're going to have babies. I've seen several generations over my lifetime of infertile couples and their kids. So, at any rate, that's a long way of answering that we can solve the male factor, the male infertility problem now.
That's amazing. Switching gears a little bit, sometimes IVF seems a little scary to many at first. Does it increase the risk of genetic abnormalities at all?
So the question is whether, if you go through IVF, are you at risk, increased risk of having an abnormal child or genetic abnormalities? Well, the simple answer is really no. These children are completely normal. There's been over 5 million children so far born from IVF in the world, and there's no greater incidence of any abnormalities in these children than in a routine, regular, fertile population. But I want to make sure that I'm not overstating it, because in any normal population, about 3% of the children will have some kind of abnormality. Usually they're no big deal, like maybe an extra little finger or maybe a cryptorchid testes, and all these things are fixable. About 0.5%, though, are pretty serious abnormalities in any normal population. So as long as I make that proviso, that anytime you decide to have a baby, there is a risk that you'll have a problem. But IVF doesn't increase that risk. We followed these kids for so long. The first IVF baby was in 1979, and Louise Brown was completely normal, and there have been 5 million since then, and we just don't see any increased risk of any abnormalities.
Thank you. What are some options that couples can consider other than IVF?
So the question is, many couples don't want to go to IVF right away. Now, in a country like Denmark, everybody goes to IVF right away because it's all paid for. In a country like Israel, everybody goes to IVF right away because it's paid for. So couples themselves want to go to the procedure that is the most effective and will get them pregnant the fastest without dilly-dallying while the eggs are getting older and their chance for getting pregnant, even with IVF, is getting lower. Most couples in any population, if they're infertile, will prefer to go to IVF sooner than later. The problem is cost, because we know in countries where there is no cost for the couple, 10% of the babies born in Denmark are IVF babies. I think even a larger percent in Israel are IVF babies. So in America, maybe 1% or 1.5% of our babies are IVF babies. And that's because so many women really don't have access to it. So frankly, I may be getting off that subject, but it's really important to control the cost of IVF. Most IVF centers are just adding one stupid thing onto another that sounds like it's good and brings the price up from what should be maybe $9,000 or $10,000, including everything, to over $20,000 or $30,000 for just one cycle. So I think that's a terrible development, which is making more money per caseload for IVF centers, but isn't really improving the chance of having a baby, and in fact is blocking IVF out financially from so many couples. So we think that it's important to do many IVF procedures that have very high pregnancy rates but reduce the cost of the IVF dramatically.
Amazing. So we hear a lot about endometriosis, and how significant is that really when it comes to being a cause of infertility?
You know, that's an interesting question because we keep hearing about endometriosis at all the medical meetings. Half the meetings are talking about endometriosis, and everybody has different ideas and different theories about it. And women may go through multiple surgeries to try to get rid of endometriosis. And I've said a long time ago, I still find this to be the case, that most endometriosis surgery will actually reduce your ovarian reserve and reduce your fertility and create scarring and adhesions rather than really improve your chance of getting pregnant. We know that if you have endometriosis or don't have endometriosis, your chance of pregnancy with IVF is absolutely the same. There's no difference. Endometriosis does not reduce your pregnancy rate with IVF. So I think surgery for endometriosis, which is common and popular, is usually being done by doctors who really don't have access to IVF. And I think that little lesions of endometriosis all over the pelvis have no impact on infertility. That was proven years and years ago. And if there's a big lesion in the ovary, okay, that can be reducing your ovarian reserve, but often the surgery to remove an ovary endometriosis kills a lot of the ovarian eggs and destroys eggs inadvertently, and so it causes more problems than it helps. And in women maybe will often worry that they have endometriosis because they have painful periods. The most common cause of painful periods is just that the uterus is sloughing all this tissue when you're having a bleed, and it's not really the endometriosis that's causing the painful periods. You go on birth control pills, painful periods become painless and easy to handle. So it's a real thing, but I think, in my opinion, endometriosis is overemphasized.
Thank you. Another issue that we hear about a lot about recently is egg freezing. So with stories that have been in the news recently, can you just give us some basic information about egg freezing and what's going on currently?
Egg freezing is becoming more and more popular. Women may not think that they're going to get pregnant for a while. They want to preserve their career. They can't find a partner. They haven't found a partner who's interested in having a child or that they can trust. And so more and more women are fearful, correctly fearful, that by the time they're ready to have kids, they'll be 39 years old and their eggs won't be very good anymore. And so I recommend that they have their eggs frozen in their 20s, really, if they want to be secure. But we were the first to actually bring egg freezing to the United States. And it was a terrible procedure that didn't work with the old freezing methods. With vitrification, which is an ultra-fast freezing method, we showed that we can successfully freeze eggs and get babies from them. And there have been studies showing that you can freeze your eggs and have babies 15 or 20 years later from those frozen eggs. But it's not as good as fresh eggs. There's a lower pregnancy rate, and there are clinics that are advertising it, doing it commercially, and they really aren't doing a great job. I'll show you with motions. The difference between, say, having a high success rate with the frozen eggs is when you take it out of the liquid nitrogen and you put it in the warm petri dish at 37 degrees. If you do it like that, it'll be too slow and your eggs will die. You have to do it like that. And you have to do it delicately. So the difference between that and that is the difference between having a success and not a success. So vitrification is really a dramatic breakthrough, and we were among the team that developed it and brought it to America in 2003. But if you can't change the protocol. You can't improvise from the laborious trial and error technique that cryobiologists in Japan use to perfect it. And you just have to stick with that trial and error protocol. And if you try to improvise, then it's not going to work. And I just saw a patient today that was just tragic. She was thinking ahead, and at age 34, she went to a big clinic to have her eggs frozen, and she had many eggs frozen at 34 when she was younger, and they were good eggs. At age 42, she came back to have the eggs thawed, and none of them worked. She didn't develop a single good embryo from all of those eggs. And so there's going to be tragic heartbreak when women come back thinking they had security of frozen eggs, and they find out their eggs were either not frozen well, or even if they were frozen well, they weren't thawed properly. So it's a tremendous boon, but you got to worry about the commercialization of it and over confidence and security. So a study done in Spain by a very good egg freezing program in Spain showed that if you want to really have a 97% chance of having a baby from your frozen eggs, you better freeze 40 eggs. And even then, a few women it won't work for, obviously. But that's a lot of eggs. That means 3 or 4 cycles of IVF-type stimulation to retrieve those eggs and freeze them. If you just think one cycle is going to be adequate, it won't be. And if you're going to do it, you should do it when you're young rather than when you're older.
Thank you. You answered questions from the feed while you're doing that.
Okay.
If you have a regular 28-day cycle, is it possible that you don't ovulate?
So the question is, if you have regular 28-day cycles, is it possible that you're not ovulating? No, if you have 28-day cycles, I think you're ovulating. But there is a question whether you're ovulating late in the cycle. Like if you ovulate on day 18 or 19 instead of day 14, the eggs won't be as good. So despite 28-day cycles, you may be ovulating late in the cycle, have what we call a short luteal phase, and not really be ovulating with quality.
Thank you. Do vasectomies and tubal ligations result in permanent or irreversible sterilization?
Well, vasectomies and tubal ligation are usually meant to be permanent, but frankly, we developed these procedures with microsurgery in the 1970s that surgeons nowadays, reproductive endocrinologists nowadays, are not trained to do. All they're trained to do is retrieve eggs with a needle with ultrasound. They're not really trained to do the microsurgery, which is very sad because we can reverse vasectomies with microsurgery with 90% success, and then the husband can get his wife pregnant naturally. And tubal ligations, we can reverse them with 95% success, and then the woman gets pregnant without having to go through IVF. And the surgeries are small incisions, and they're minimally invasive, and they're not very painful. So we can do sperm retrieval plus ICSI IVF, we invented that, or we can do tubal reversal with microsurgery, or we can do IVF for women with blocked tubes. But frankly, another option, and it's an emotional choice what they want to do, we can just do one simple operation, and the woman doesn't have to go through IVF, whether it's a tubal reversal or a vasectomy reversal.
That is amazing. Man, we have run out of questions. We have one quick question from Sarah online. Is when we were talking about egg freezing, is that the same thing as cryopreservation?
Yes, cryopreservation is the fancy medical term for egg freezing, but cryopreservation means you could be freezing eggs, you could be freezing embryos, you could be freezing ovarian tissue, you could be freezing sperm. Cryopreservation just means cold storage or freezing, preserving fertility by freezing. That's a fancy word, but it's freezing. Now, there is one problem with the word freezing. That implies you're making ice, and of course, ice expands. That's why ice cubes float to the top of your soda, and they don't sink, because when you make ice from water, it expands because the molecules of water crystallize, and there's greater space between the molecules, so an ice cube is lighter than water. But that expansion, if it happens inside your cell, and 70% of your cell is water, of all your cells in your body, 70% is water. And so the reason you, say, die from being frozen, or your cells die, is that water, which is 70% of what you are, freezes and that's the word for it, freezes and expands. So by cryopreservation, we can be removing that water from the cells so that we don't kill the cell when we lower the temperature to freezing levels, or we can simply put in a cryoprotectant at high concentrations, freeze very quickly, instantly, 23,000 degrees centigrade per second, and that way you don't form ice. You don't form ice cubes inside your cell. What happens is the water just turns to glass. And so we call it vitrification, and we don't harm any of these cells. So that made it possible to successfully freeze eggs because we couldn't freeze them before, and we can freeze embryos with almost 100% success without hurting those embryos. We can freeze ovary tissue for cancer patients or women who want to save their ovary, and we can certainly freeze sperm, can freeze testicular tissue very, very safely nowadays with these methods.
Thank you. And you mentioned frozen or using that technique for ovarian tissue. Can you give us an example or patients' stories about that type of procedure?
Yes, we have many fantastic success stories, and in fact, we went on the Today Show just a couple of months ago, Megyn Kelly, with one of our many, many, many such patients who had cancer when they were young, say 17, 18, 19, 20, Hodgkin's disease or leukemia or many other cancers. We froze, this is going back to 1996. We froze the ovarian tissue, and then 20 years later, we transplant it back, and it works normally, but it's a young ovary, so the eggs are fantastic. And they get pregnant naturally without even IVF. So the case we had on the Today Show with Megyn Kelly, she already had 4 babies from tissue that was frozen when she was 19, when she was told by her cancer doctors she would never be able to have children. They could save her life with a bone marrow transplant, but she'd never be able to have children. And she has 4 children because we froze her ovarian tissue before we even knew if it would be a successful procedure. And it turns out now it's very robust and very successful.
And we always love the stories that provide so much hope for patients. We have one last question. What are your beliefs regarding being overweight or obese and seeking treatments, especially with PCOS and thyroid being in the mix?
Okay. Well, so PCOS, contrary to a lot of the common talk, is not really caused by being overweight. It's caused by being born with too many eggs. Now, overweight can aggravate it a bit because your fat cells secrete estrogen and suppress ovulation. But in the classic cases described 70 years ago, the women were overweight because there was no ultrasound or hormone evaluation. But here's the issue with overweight. It's not healthy to be overweight. You should not be overweight. You should lose weight. But if it's going to take you 2 or 3 years to lose weight, and you're already 35, then you're going to be 38 before we do IVF, that is diminishing returns, and that's a big mistake. So I don't tell patients that are moderately obese they've got to lose weight first. I think we go right to the earliest treatment while their eggs are young enough. But I don't know, I mean, if you weigh 280 pounds, that's a terribly dangerous condition, and I'm not sure you can easily lose weight with standard methods, and you may want to have a gastric bypass type procedure. And if you're young, okay, you have time to wait. But if you're older, your eggs don't have time to wait. So it's an important, delicate balance. I don't believe that overweight is a significant cause of infertility. It just complicates the treatment of it.
Thank you. That's all the questions we have today.
Well, that's great. This is Dr. Sherman Silber from St. Louis, Missouri, the Infertility Center of St. Louis. As Warren Buffett often refers to us as the Berkshire Hathaway of infertility, because here we are in the middle of the United States. It's not New York or Los Angeles, but our patients with the most difficult problems come from all over the world, from everywhere. And no matter how difficult the problem, we're happy to deal with it. And you can always reach us at our website, which is www.infertile.com. And please send in your questions, and we'll answer them again on the next Facebook Live. Thank you.